The first step in a field amputation is to assure you have adequate body substance isolation. At a minimum, this includes eye protection, face mask, gloves, and some type of fluid impervious gown or suit. Next, remove any clothing and apply the tourniquet proximally to the site of the planned amputation, but not over a joint. Tighten the tourniquet until all visible bleeding has stopped and mark the time the tourniquet was placed. Next, apply sterile towels over the proposed area of amputation. Apply betadine over the area of amputation and allow to dry for 2 minutes. If needed, you can use towel clips to help hold your sterile towels in place. Next, using the scalpel, incise the soft tissue medially and extend the incision laterally as far as possible. The tissue is then incised down to the bone. Place a Kelly clamp directly beneath the bone. Maneuver the clamp back and forth to help facilitate dissection and provide space between the bone and soft tissue. Take a corner of a laparotomy pad and place it within the jaws of the clamp and pull through to allow the lap pad to be underneath the bone. Remove the clamp. Grab both ends of the lap pad and move in a back and forth motion to further dissect the soft tissues away from the bone. Grab both tails of the laparotomy pad with the left hand and use as a handle for retraction, pulling towards the patient's head. Next, the saw is used. Remove the safety on the saw. Check function of the saw by turning the saw on. Place the saw directly over the bone to be transected and cut perpendicular through the bone. You will feel release of the bone, which will indicate when to stop sawing. Once you have cut through the bone, place the safety back on the saw and put the saw down. With a Mayo scissors or scalpel, cut through the remaining tissue. If you have further bleeding at this point, the first step is to apply a second tourniquet either above or below the first tourniquet, depending on how much space there is on the limb. If bleeding continues, direct pressure is applied over the site of the bleeding. If that is not possible, selective clamping of bleeding vessels using a Kelly clamp is used as a last resort. Once hemostasis is achieved, generous, sterile, soaked gauze pads are placed over the amputated limb and secured in place with an ACE wrap. If possible, retrieve the amputated limb and dress with sterile saline soaked gauze and place within a clean bag and transport with the patient.